This coming Wednesday, the really first order of real business of the House, we are voting on health care reform repeal. The new Republican majority has decided that this is the most important issue, even though they know that it's political theater, a charade. It's not. It may pass the House, but it won't pass the Senate, and certainly the president would veto it. So this is not becoming law. At a time when we have so many pressing issues, I'm really saddened that the majority wants to conduct this political charade. You know, if there are problems with the health care law, we don't have to repeal it. We could change parts of it. We could tweak it. We could put out of the bill what we don't like and keep in the bill what we do like. But unfortunately, the attitude or the decision has been made to try to repeal the whole bill. My constituents understand, and that as we speak now, the Rules Committee is discussing what kind of amendments to allow. And we know no real meaningful amendments, if anything, are going to be allowed. So the Republican majority coming in says that they're going to have open rules, and we're not going to really have an open rule on the very first bill that they're going to attempt to pass, which is a repeal of health care reform. I think that's wrong. I think there are many of us who feel strongly that there ought to be some rules that we can, some amendments that we can put in to ensure that the good coverage that we have achieved in the health care bill is kept. Surely it's not everything that's wrong with the health care bill, which my colleagues oppose. I want to ask them, since they want to repeal the bill, are they against the part of the bill which says that you can keep your child on your health care bill, on your health care coverage till age 26? I think my constituents like that, and I think theirs do as well. Do they want to repeal the part that says that an insurance company can no longer deny you coverage because of a so-called pre-existing condition? I think that's something that all constituents like and appreciate. Do the people that want to repeal the health care reform bill want to say to insurance companies it's okay to put caps on people, so when they pay their premium year in and year out, and then they finally get sick and they ask for coverage, the insurance companies can tell them, well, sorry, not only do you have a pre-existing condition, but there's also a cap on benefits, either an annual cap or a lifetime cap. So therefore, we're not going to cover you at all. I don't think anybody's constituents wants that part to be repealed. And what about the donut hole for seniors in Medicare Part D? You know, seniors have found it very, very difficult. They get part of their prescription drugs paid for, and then there's a donut hole, which is for a long time. They have to pay for everything themselves, while at the same time still paying their monthly premiums to the government. And then at the end, they get the government to come in and help them. That has put a tremendous burden on seniors. And what the health care bill, which was passed by the last Congress, does is it eventually removes that donut hole for seniors so that seniors can get back money, and it starts right away where they can get back money to help pay for those prescription drugs. So I think that we hear a lot about the lame duck session and how we all work together, and how the big question of the new Congress is going to be, is it going to be a stalemate? Is it going to be gridlock? Or is it going to be people coming together in a bipartisan fashion to try to work together? If the first bill that the Republican majority is putting on the floor is any indication, it seems to me that they've chosen gridlock. And I think I'm really sorry about that, because I will admit that there are some things in the new health care law that should be changed, and that we should work across the aisles together to make sure that changes. But to repeal the provisions that benefit my constituents and everyone else's constituents all across America, to me makes no sense whatsoever. The big insurance companies have had it too big, too long, and my Republican colleagues, unfortunately, are right in bed with them. And I think that is something that the American people ought to see. Who do we care about? The big insurance companies? Or do we care about the average American who is struggling day in and day out to get health care coverage. We have almost 50 million Americans without coverage, and it's not only the people who are not covered now, but it's working people who will find out in the days and months ahead, if there is no health care bill, that they will be added to the rolls of people who are uncovered. And that people working hard will find out that the 50 million will swell to 60 million and 70 million and maybe even more. And so it's going to affect all of us because the health care costs have been rising way, way beyond the rate of inflation. And that's why we needed to have health care reform. So I would say to my friends on the other side of the aisle, let's not posture politically. Let's try to put our heads together and work in a bipartisan fashion to do something for the American people. If there's something in the bill that needs to be changed, then we should change it. But repeal is not the answer. Every major bill, from Social Security to the Civil Rights bills of the 1960s to Medicare and Medicaid, all had to be tweaked after they were passed. All had to be changed a little bit. The same thing is with this bill. We should not repeal it. We should fix it. Thank you. I yield back.
Gentleman from New York.
I rise in opposition to this amendment. It seems that the openness that the new majority promised us lasted half a day, and the more things change, the more they remain the same. I urge my colleagues to vote no.
That's